Hello and welcome. My name is Tom Zolnay. I am the President and CEO of University Hospitals Kingston Foundation, and it's my pleasure to welcome you to our virtual Circle of Care event. Thank you all for joining us. You were invited to participate because you understand the value of investing in our healthcare, and thank you for your contributions of time, talent, and treasure. You are making a difference in the lives of others. So these Circle of Care events are held 3 times a year. Normally they're held in person. Unfortunately, with the pandemic, we have gone virtual and have been doing so now for a little over a year and a half. And the purpose is to provide you, our donors, an opportunity to get to meet some of the people that are providing the care in our community. This webinar is being recorded and will be available for you to view through our website or our YouTube channel. And after each of the 2 presentations, there will be an opportunity for you to ask questions. But the way in which this is going to work is that as you're listening to our speakers, you can go to the Q&A function on your screen and type in your questions, and that they will then appear to our speakers when they conclude their presentation. You can ask questions anonymously by clicking on the box on the bottom left of your Q&A screen. And if you have any questions that, or rather if someone else has asked a question that you like, then there's always an opportunity for you to just give a thumbs up so that our speakers know that that's a question that is of interest to a lot of people. This webinar will last for about an hour. And as I say, there'll be an opportunity for you to ask questions. Today's topic is aging gracefully. And first up is Dr. Chris Frank. He's a professor in the Department of Medicine and Division of Geriatric Medicine. He got his medical degree from Western Ontario in 1989. He completed family medicine training at Queen's University and did additional training in care of the elderly at Queen's. He has a focused practice in geriatrics and palliative care. His clinical roles include inpatient geriatric rehabilitation, palliative care inpatient unit, acute care consults, and liaison roles. And he also does outpatient geriatrics. So welcome, Dr. Frank, and the floor is all yours.
That's great. Thank you very much. I'm sort of showing some of my middle-aged aspects by having lots of technical issues in the lead up to this, so hopefully things will unfold. And I did want to start off before I will use some slides to thank you for coming, and thank you obviously for your contributions and your connection with the Hospital Foundation. I tend to work with people on the frailer end of more clinical frailty than sort of the well elderly. Unfortunately, the well elderly or the well older adults outweigh the frailer population. And I use frailty not as a disparaging term, but as a clinical term. So I don't do a lot of exercise prescription. However, I do a lot of activity promotion. And I think that, you probably will view yourself in kind of, the goal of this talk is really to make you think about your own level of activity and the important role that activity, and I'll say that specifically as opposed to exercise, can play in aging gracefully. So I'm just going to share my slides. So keeping active in middle age and beyond. And it's worth knowing that Kingston is actually the location for what's called the Canadian Frailty Network. And that is a sort of somebody that stimulates research in clinical frailty. And frailty is a term that just means a vulnerability to stressors that happens as people age. It's not, as I said, a disparaging term, but they have developed this thing called avoid frailty, which is obviously an acronym for ways to ensure healthy aging. And the first A is actually activity, and that's going to be our focus. But the other parts of avoid frailty include vaccinate, optimize medications, because medications are very good, but can also cause troubles, interact, which has obviously been a much bigger challenge over the last 2 years, and then diet and nutrition. And it's very interesting that it was harder to find a kind of somebody that was really a strong proponent of expertise in nutrition as people age. And it's probably an area that the average physician should probably be better at. But I'll share a couple of thoughts in addition to some thoughts about activity. So it's really good, no matter how old you are, to really say, what are your passions? Because passions tend to kind of drive the way we do things. And I think particularly over the last number of years, people have really taken up some new passions and hopefully re-stimulated some other passions. So I'm going to just share one of my passions and something that for me has been really helpful in maintaining activity and physical fitness, which was setting quite a high level goal. But more importantly for me too is what does every day look like for me? Because particularly as we age and there's some less opportunities for formal activities, how we live our lives is more important. So I'm just going to show 30 seconds of a video. He thinks he is. Sorry.
Today is day 7 of the BC Bike Race, the final day. It's Whistler, the mecca of mountain biking. The participants will experience everything that this valley has to offer. It's known for its bike park, but what exists in the valley is an unearthed gem.
So hopefully I'm back online. I showed you that just because I think, your passions can be so important in driving the way you approach things. But also there's a lot of obviously connections and interactions there as well. And sorry, I'm losing my screen here, which is always a bit of a challenge. So that gave me a big focus, months of training, etc. But what was really important for me wasn't so much that, but what every day looks like. And I interestingly developed an elevator phobia, which was very helpful because it meant that I tended to take the stairs at Kingston General Hospital instead of taking the elevator. And this isn't actually my bike, but I do ride my bike every day, including this morning. And these are all things that I think are way more important to my aging gracefully than participating in kind of more higher level types of activities. And I think active transportation is a perfect example of the way that it's easy for most people to start to get a little bit engaged with fitness. So what are your goals? Aging well, being active or actually fit, or sort of competing at a competitive level, such as in a master's thing. And most of us really want to focus on the aging well component of things. And this is an interesting this is taken from something called Blue Zones, which is very unscientific, but probably quite wise. And it looked at areas where people where there's the highest rate of centenarians. And one of those areas actually is in Nova Scotia, interestingly enough. But they looked at and saw what were the characteristics of people that lived a long time. And moving naturally, having the right outlook, eating wisely, and that 80% rule is that never eat to fullness, which is not a great thing for most of us North Americans. A focus on plants and very moderate use of alcohol. And then that belonging, family first, who do we belong to, and sort of obviously the aspect of genetics. But you see at the top of the pyramid is moving naturally. And one of the examples was in a place called Sardinia in Italy, where people tend to live longer. They live in multi-story houses that are intergenerational and take the stairs a lot and climb big hills to get their groceries.
Chris, your slides seem to be stuck on number 3.
Oh, okay.
I've lost them altogether.
Yeah, no, let me just, what slide are we on there, Tom?
We're on 6 now.
Okay, so this was the slide I was just referring to, which is that pyramid Moving naturally was the one I mentioned at the very top of things, and the other parts of the pyramid being very important. And one of my colleagues who also works with predominantly older adults, has made the point that a lot of people, no matter what age they're at, say they don't have time for things. And this was taken from the talk that I gave to medical students some time ago, where clearly they've got a lot of issues to prioritize. And it was, the talk was giving them some thoughts on living a balanced lifestyle. But I think even for people around this table, I'm sure that screens are taking up an increasing amount of time and can be a real boon. For example, being able to participate in online exercise classes or online yoga classes, etc., during the pandemic. But a lot of older adults, when surveyed as to why they're not exercising more, say it's because I don't have enough time. And I think it probably behooves all of us to look at the amount of time increasingly that we're spending on screens, and trying to consider how how we could better use that time. This is a slide I showed the medical students as well, which I think is good for all of us at any age, and it's part of that living gracefully. But the first thing you'll see there is turning off your TV, leaving your house, knowing your neighbors, look up when you're walking. All of these things that make a more active lifestyle so important is also the connection with community as well as your personal benefits. And I did mention to the medical students that, you know, the power of habit, and actually the people around this virtual table, you know, have a lot of advantage over the medical students in that the older you get, the more you're able to focus on discipline and to focus on technique, and you've already learned that power of habit. And I have my routine in the morning, which is, you know, sort of doing some stretching, doing some push-ups, some chin-ups, and I take a little bit of pride in being a cyclist that can do some chin-ups. But the first time I did one, I couldn't do one, and the next couple of days I was able to do a full chin-up and, you know, keep on trying to work on that. But that for me is my routine every morning, is that same thing. And I also pay attention to the technique of all of the fitness things I do. So I've actually got an advantage over the medical students in that regard. I think as one gets older as well, it's particularly relevant to figure out what can you do on your own and what do you need assistance with. And there's certainly lots of, you know, books that relate to a lot of different activities, helping you to develop the confidence and the skills to participate in things. Increasingly, I see people at City Park, for example, you know, of all ages with, you know, participating in CrossFit classes, etc., but also having personal trainers. All of those things can really help give people confidence, particularly in trying to start off an exercise regimen, groups and clubs. And as I mentioned, we've all learned the advantages of online options for, for providing you the impetus, but also some of the skill sets and the access, particularly these days. What is the evidence? The article on the right is interesting in that it's looking at the risk of death in high-level elite young athletes. And the risk of death is something that often makes the media, but the risk of activity for older adults, particularly older adults with any level of activity, is very, very small. There is no longer that recommendation that if anybody goes back to any level of activity, you should be seen by a physician and, you know, receive a wide range of cardiac investigations. And even in young adults, the evidence for screening to identify things that could cause an unexpected cardiac event is remarkably mild. However, if you are a middle-aged and older person who is having symptoms of cardiac disease such as chest pain or shortness of breath, unusual symptoms like dizziness, those are things that before you start an exercise program, probably wise to speak to your primary care provider. And certainly if you're going from being a sedentary person to try to participate in high-level activity, you know, such as a sedentary person that suddenly decides to go out and play winter, beer league hockey, then that is actually a pretty good indication to get checked out. So sometimes people will shy away for fear, but the evidence of benefit, including things like Tai Chi being very helpful for people who have neurological disorders such as Parkinson's, also good evidence for weight loss, some evidence for other forms of balance training, and flexibility having some relevant thing. But you see that one thing that people tend to not include in their exercise prescriptions, their self-prescriptions or ones done by physicians, would be underdosing strength training and neglecting the role of flexibility. So I always think when discussing with patients, but also myself, is that you're looking at sort of cardiovascular fitness, you're looking at flexibility, and you're looking at strength. And all of those things together have certainly been shown to improve mortality, to prevent frailty or to decrease the severity of frailty, as well as improving quality of life that I'm sure Dr. Andrew will allude to in her session, because exercise is being very good, shown to be good for depression. Summarizing meals, and people around this table hopefully are a little bit less reliant on food delivery services than younger people in my observations. This is taken from sort of one of the famous books about eat food, as in real food, not too much and mostly plants. And this is the advice I gave the medical students, is get a crock pot and a good crock pot cookbook. And I think it holds true for people around the table. And my life has been saved by a good vegetarian crock pot recipe book. Did want to alert you to this thing called Fountain of Health. And I actually mentioned it to a patient on the telephone today when we were talking about setting goals. This is easily found on the web. It's a Canadian innovation that uses the principles of positive psychiatry to help people age better. And this can be started when you're 25, and it can be started when you're 75. Because of my technical limitations, I'm not going to show the questionnaire, but they start off with a questionnaire in a variety of spheres that relates to healthy aging, including activity levels, but also social connection, interest in learning, etc. And then it gives you some strategies for setting SMART goals, or ways of trying to clarify what a goal in each of those spheres are, particularly choosing the areas that you may not be doing so well in. So if you're thinking of ways of aging a little bit better, no matter how old you are, the Fountain of Health is really worth having a look at, and doing their pre-goal questionnaire, and then choosing some goals and having the follow-up that they ascribe. So this, I'm not sure if this will show. It's the last day of my race, but more importantly, I did want to finish with this New Yorker slide, which was supposed to move over in front of the picture of the kind of vigorous middle-aged person, and that is a really important point. I think that we think of activity and sort of health, and if you think of images of healthy aging, it often is showing older people with big muscles, doing CrossFit. In fact, there's a little meme that's a very strong-looking older lady, and the caption is like, "If you put me in a home, I put you in the ground." We tend to equate healthy aging with this physical vigor, but the reality is that all of us at some point in our lives, no matter how fit we are, we'll have some of the challenges as well as some of the strengths of aging. And I think it's really important that we remember that, we will all develop a degree of frailty, and our efforts at activity are to improve our quality of life. But, if people have a greater degree of frailty, it doesn't, it's part of the aging process, and we need to value their experience and their situations, and we shouldn't only think of aging as being kind of robust people. So there's an excellent talk by a US geriatrician called Louise Aronson that I'll send the link to the members of this group, that I think has some really interesting perspectives on aging. So we all want to go out and be as healthy as possible, but I think we shouldn't probably view the challenges of frailty as being something that's a failure of the individual, because I think we all need to reconcile ourselves. No matter how fit we are, at some point we will have some of these challenges, and all these other strategies we're talking about will help us to bear them better. So hopefully that is the end of my technical issues. Are you able to hear me, Tom?
Yes. Thank you, Chris. I don't see any questions in the Q&A. I don't know if anyone has any last ones they'd like to put up or save them for the end. So,
I'm sorry, you went a bit fuzzy.
I was just saying that I'm not seeing anything in the Q&A at this point, so maybe they'll come up a little later. So, but thank you for reminding us of the value of getting out, getting active, and getting connected with others. And hopefully there'll be some more questions at the after Melissa's done her piece. So next up is Dr. Melissa Andrew. She's with the Division of Geriatric Psychiatry at Providence Care. Dr. Melissa Andrew completed psychiatry training and a 2-year fellowship in geriatric psychiatry, followed by a master's degree in health professional education at the University of Toronto. She's associate professor in the Department of Psychiatry at Queen's University. Began working with the Senior Mental Health Outreach Program based at Providence Care Hospital in 2002. Welcome, Dr. Andrews.
Thanks very much. It's a pleasure to be here. Hopefully you flag me down if there are any technical issues. In addition to my clinical role at Providence Care, doing outreach, visiting mostly seniors at home and where they live in the community, I'm also a resident wellness advisor for some of the postgraduate trainees that you would see around the hospital, all of those who are finished their MD but are residents in training. And that's my Wednesday job. And you'll see a little bit of the flavor of that coming through this talk, I think, as well. So my job was to talk about the psychological well-being, mental health side of aging gracefully. And I deliberately picked this picture to set the tone. You might think it should be a plant at the end of its life to be truly symbolic, but I think something that's a bit of a new shoot, new growth, new beginning, coming through something pavement that's a little bit older with a few cracks, maybe is really where I felt was a good place to start, and a little bit more real life. So I thought we might start with I just got to figure out how these slides advance. There, oops, well, I gave you the answer. A little brain exercise. So here's the example. If this picture represents unfinished symphony, I will give you another one, hopefully without the answer popping up right away. What does this represent? Give you a second to think about it. I know it's hard to shout it out. You can't possibly do that. You can put it in the chat if you have a brain epiphany really quickly. But this one is actually no U-turn. So we'll come back to a little bit of brain exercises later on because it fits in the theme, but that's just by way of a little introduction. What I think we will really focus on first this is definitely an area, mental health in older adults, where there are a lot of myths and popular beliefs that are probably not true and probably getting in the way of a lot of perceptions that I wanted to go over. Really a focus on taking care of the brain and how you can age gracefully by doing that, as well as your physical body and activity. These are going to be very complementary. And finally, a strategy that I've been reading more about and learning more about practicing in terms of practicing gratitude as a role in maintaining well-being as you get older. So here are some of the myths. And we see a lot of these in the popular press, and it's very pessimistic in general. The idea of mental health as you age, there's a real sense of pessimism that everybody's going to be unwell. It's predetermined, it's in the cards. If you are unwell as a younger person, well, that's just going to be worse in older age. As Chris said, physical health is really more the focus. Mental health is sometimes the thing that gets ignored, pushed to the background, and a real nihilistic sense that treatments don't work. Well, even if you diagnose something or see something, why bother? It's not really important because the treatments don't work very well anyway, and you might as well just not know as dive into all of that. And really the prize at the end of your life is you just get dementia, and everybody will. So I think that is a bit of the sort of popular myth state of things. Now here's some actual facts, and I'm just going to see here. I have to move. Okay, just got to move the heads here. So there. In fact, mental health problems are not a normal part of aging. It's true that it is fairly prevalent, and maybe 1 in 5 older adults will have a mental health problem, and probably up to 1 in 3 if you get into your 80s. And that's what my dad always says. He says getting older really stinks, but it's better than the alternative. So there is something of the prize for living longer is that you do sometimes come into more difficulties, but it's not inevitable. And having depression or anxiety is certainly not the expectation for this stage of life. It's definitely not predetermined. In fact, everybody can develop as navigating kind of a difficult transitional stage. Anything is possible as far as developing a new issue. But most importantly, the older adults can be helped with the same degree of success as younger people. And this is probably the most important myth to bust, because it's really worth seeking treatment. And really, it depends on acknowledging that there are different treatment needs for older adults. Sometimes there's a real nuance to treating with medications, how to balance medications with non-medication treatments, using medications in a slightly different way, but making sure that the treatment's adequate, making sure that physical problems are also attended to. So it's not just a depression, but it's a depression in the context of diabetes and chronic pain. It's totally different thing. And probably an important aspect is making sure that the problems are not overlooked in the first place. And this is often easy to do, partly because older adults don't tend to complain, because they believe some of the other myths, like this is just normal, and why would I bring it up to my doctor, or there's nothing they can do about it anyway. But there's also the stigma on the side of the medical field that maybe older adults are supposed to be unhappy, and technically it can be a little bit more difficult to pick up some of these issues because they're not exactly the same in the way that they appear in the patient as compared to a younger person. So maybe there's a little bit of stigma or lack of knowledge there, and so it's a real area that's important for advocacy right now. And if something is really not quite right, I think the important lesson is, make sure that you're a little bit persistent with your physician. Many physicians are good. It's getting better and better all the time, but just an important nuance to know that not, sometimes there is that little bit of hesitation for a whole number of good reasons, and it's fair to advocate. So as I said, one of the reasons that mental health is such an important consideration as you sort of move into later adulthood is this is a time of gigantic transition. And from all of the other times in your life that transitions are always a moment of vulnerability. Every time you shake up the status quo and you move into different roles, into different states, some people come, people go, you lose things, change your routines. It's always a time where the floor isn't quite as firm underneath your feet. And it really is a time of real vulnerability. So not to feel at all if a new mental health well-being challenge comes up at this stage of life, it's not a failure. It's not that you failed to navigate it, or so there's a problem, you did something wrong. It's that it's a really natural consequence of a whole lot of upheaval. And there's probably no greater upheaval other than the kind of opposite end of life where you're graduating school, getting into a job, getting married and having families. That was such a time of great upheaval. But there you get a lot more you get a lot more energy usually to navigate that in the early stages. But as Chris said, in the older stages, you have your experience and wisdom and maturity to navigate it too. But it is a bit of a new ball game. So I really didn't want to focus too much on the doom and gloom of this. It starts to sound like, oh gosh, here's losses and health is going and retirement roles, losing all the places where I'm productive. It really sounds quite pessimistic. I think really wanted to take a focus more on prevention and being proactive. And one of the big worries for older age is always worrying about what's going to happen if I decline cognitively. Sometimes, I think people often feel like I could handle declining physically if I had to, but losing my mental abilities, my thinking, my ability to recognize my family, that would almost be the worst nightmare. So we wanted to touch a little bit on some of the things that have evidence for preventing cognitive decline. And we've been here a little bit before in Dr. Frank's talk, but there's certainly a lot in the media about stuff you can do. And this, you'll notice on this list, there's not a fancy list of expensive things. There's not a special product like coconut oil, or there's not a special pill that you get at the health food store. There's not a fancy program that you buy online that's a guarantee. These are really kind of common sense things, but honestly, these are the things that have the evidence that they will work. And being active physically, keeping up your fitness, a healthy diet, the mostly plants, leaning toward the Mediterranean. I would add that the moderation piece of diet also includes alcohol. Probably anything above a glass of wine or one drink a day is considered not moderate. We had some hope for a while that red wine was a good thing for preventing dementia, and people were using that quite liberally, but probably needs to stay in a more moderate 1 drink a day overall to be of global benefit, but it was a good try. I was hopeful there for a bit. Maintaining social connections. There was a really interesting study about people who went to church, and those people were less prone to developing both depression and dementia in older age. And of course, it was like, well, they went to church, but it probably wasn't the fact that they went to church per se. It was the fact that they were part of a part of a community, and they were connected, and they were interacting, and they were engaged and being with others. And so certainly church is a great way to maintain those connections and sense of community. But however you do it, that's probably an important facet. And our pandemic experience over the last 2 years of anything has really, really challenged this. So our big challenge in moving to the next phase is, how do we restore those connections? And we've probably forgotten a little bit how. But it's not just about how do we go back to a restaurant, it's how do we get those meaningful personal connections that might have been lost. I'm going to talk a little bit about brain exercise in a second, but I wanted to touch on sleep. And here it really is the pot calling the kettle black. I almost didn't want to bring it up because I'm really not the best one at doing it. This is what I'm working on as well. But we know that sleep plays a really important role in brain health. And increasingly, it shows that a sleep disturbance will increase the risk of developing both dementia and depression or in later life. Quality of sleep, restorative sleep, your brain really needs that time to sleep and regenerate. And we're just learning about all the molecular bases of that, but it seems increasingly clear that 7 or 8 hours of sleep is important if you can get it. And that nice sleep routine will be really helpful as aging tends to kind of shift that naturally. So the more you have a routine, the better it will stand up. And one thing that is really, really important is making sure that if you have any kind of obstructive sleep apnea, been told to wear a CPAP machine, that you actually do that. It seems like it's a real pain in the neck, and often people will discard it, but I've had a number of patients who went back to wearing it, had a little bit of a health scare, decided that they would give it a second try, got their mask refitted so that it was actually more manageable, and had a major change in cognition to the point where continuing driving was at risk, but they were able to continue to do that, having made the change. So cannot underscore the importance of seemingly something so basic like sleep. So exercise for your brain, this is the mountain biking of the mountain biking tasks for the brain that are important in keeping perfusion going. It's never too late to change your brain, and it's never too late to try to build some resilience in your mental connections. And your brain, kind of think of it like a muscle, that you need to do as much exercise of your brain as you do of your body, all in balance. So these are some of the activities that can work. You see, it's like pretty much almost anything. It's not the fancy Lumosity thing online necessarily. For a while it was Sudoku. There's no sort of golden activity that you have to do. There's not one that's great. Anything that is a little bit complex and challenging and that you enjoy is good. You can teach an old dog new tricks, though, and if you really want to do the very best form of activity, probably the best one is to try to change your routine or learn something new. And the reason for that is brain pathways. And so these are the brain signaling pathways that help you coordinate everything you do in the day. This is just a schematic. It's probably way more complicated than this. But think of it like moving to a new city. When you first go to a new city and you don't know your way around at all, you rely on just a few routes. You find your way there, but often you take the wrong turns. You go around a corner. You have to kind of figure it out. You don't take the most efficient route there, but you get the job done and you get to A to B. And that's like a little kid's brain. They're not very coordinated. They don't know how to do things. They're figuring it out. It's clumsy. As your brain matures, just like in the city, you find your way. You get your common routes. You learn the best route, the one with the traffic lights that are coordinated, and the ones that don't have traffic at your time. They're the express routes, just the efficient ways of getting to your typical places, like the grocery store or to your work or to your club, the places you go all the time. And probably over time, you get pretty efficient at that, but you drive the same routes. We all do this, and we get into a little bit of a rut. You don't try to find a different way because the one you use goes perfectly well. And so this is kind of like the middle-aged adult brain. It's pretty efficient. It's pretty slick. The stuff you do pretty well because those brain pathways are really well laid down and the brain knows what to do. But those extra routes that are on the periphery, they're not being used as much. You're not driving down those streets to explore them. And chances are things have changed on those streets. So things are going a little bit, maybe things are going a little bit downhill. There's not much traffic on them, but they're not being used and you don't know that they're there. And you just kind of forget about them for a while. So that's really the risk, is that some of those brain areas aren't getting used because you're so efficient at using the pathways that are already there. So the idea of trying to continue to build your brain reserve and keep your capacity is, how do you activate some of those side streets? How do you get those little pathways that maybe you don't use as much to be really active and engaged? Because that's going to keep up all the different options that your brain has for coordinating and thinking. You get to use all of the parts to the best ability. So in older age, you want to discover the new routes. You want to try to pick up something that's maybe a bit different that you haven't tried. If you're a musical person, is there a way that you might take up a word puzzle? Things that just are maybe slightly different, that could use a different neural pathway to try to teach an old drug a bit of a new trick. And that's really the goal. But every card game is different. And if you enjoy playing cards, you don't have to give that up and pick up crossword puzzles. Just do what you enjoy. And that's probably first and foremost. So brain puzzles can be good if you enjoy this sort of thing. Give you a couple more, just see if anybody's like totally on top of this. Anybody know what this is? That's a diamond in the rough. And what about this one? This is the odds are against you. And one more. This is probably the hardest one. I don't know. I can't see if anybody's getting these in the chat. Oh, diamond in the rough. I see Heather got that one. Do you have an answer for this one? So it's hard. Outnumbered 3-1. I was thinking 3 strikes and you're out. It wasn't quite right, but outnumbered 3-1. They've got, these are kids' brain teasers, but I think actually adults are probably a lot better at them. And they were just kind of a fun way to kind of stretch your brain. This is another fun way. This is actually has a name called the Stroop test. And it's really tricky. You have to say the word, you have to say the color of the word, but not read the word. So it makes your brain try to multitask or do 2 things at once. And it's, so if you go across the top, the right way to say it is, oh, let me do this. Red, black, green, blue, yellow, red. And it's harder than you think when the word is saying something different than the color. So be a good challenge, and you and your kids and grandchildren can compete for that one, because you're on even footing. So as you've seen, it's there's not an easy stage to navigate developmentally, and you want all of the tools that you possibly can have. Erik Erikson was a really classic developmental psychologist who laid out the pathway of life as 8 different stages, and at 8 different each stage, there's always a little bit of a struggle developmentally for people to navigate. So when you're a little infant, you go from trust to mistrust. Toddlers have to figure out autonomy. You go up to versus doubt, and teenagers, we identify with this one, identity versus role confusion. You can kind of see the struggle between those. Middle-aged adults, generativity versus stagnation, and how productive can you be? And then in older adults, it's called integrity versus despair. And integrity versus despair is really, it's the stage where you're looking back on life and thinking about what you've accomplished. And it's integrity in the sense, not of the moral integrity and truthfulness, but integrity in the sense of wholeness and integration. And have you accomplished things, a sense of cohesiveness and togetherness, as opposed to despair and regret and feeling disconnected at the end of life. So he's recognizing that it's a looking back over life stage, and recognizing that an important way to have to navigate this end of life stage is to try to make the integrity part be more prominent than the despair. You want it to be a productive reflection while still looking ahead and also enjoying the now, instead of looking back and with regrets and focus on the negative. And I think this is where the focus on gratitude can really come in, because it's just a natural part of this stage of life that you are going to be looking back over. In its simplest form, it's just a state of thankfulness. And here's a great quote: "Enjoy the little things, for one day you may look back and realize that they were the big things." And there's a lot of wisdom in that. There's a lot of science in this science of practicing gratitude. And I just wanted to share a little bit of that with you before we end. People who engage in gratitude feel more life satisfaction. They feel more satisfaction in relationships. They feel more optimism and more positive emotions. And it's not just people who are happier to begin with. It's actually a shift of focus to focus on the more positive things that have happened, and a way to dampen the negative emotions. So it's actually shifting focus rather than just a natural ability to focus on positive things. And coincidentally, there was an excellent talk on CBC early one morning recently. Maybe you heard it. It was on Thanksgiving weekend on the Fresh Air program. And Dr. Marigold from Renison and Waterloo, this is her academic focus in social development studies, is on the science around gratitude. And I'll give you the reference at the end if you want to go back and play that really excellent podcast. But there's a real basis in the brain for this science. And it's because when you practice gratitude and thinking about what you're actually thankful for, you activate the neurotransmitters, or the brain signalers, for pleasure and motivation, dopamine and serotonin. And interestingly, they've also studied the brains of people who are practicing gratitude on MRI scans. And the brain areas that light up when you're thinking about what you're grateful for and being intentional about that are things like interpersonal bonding, empathy, emotional presence, and moral judgment. It's not the reward centers. So it's not like, yay, I'm doing something good, I'm being altruistic, I'm so grateful. It's a real sense of meaning and empathy and connection at the same time, and at least it corresponds to those brain areas, which is very interesting. It sounds a little bit like what I'm advising is, we should just practice gratitude and ban all negative emotions. Just damp them all down and be positive. That's the Pollyanna approach. And this is not advocating that. It's really important to hold space for losses and difficult times and disappointments and suffering, partly because we need negative emotions to help us be motivated to make change, and partly because there's a lot of positive things that can arise from the experience of negative emotions. I mean, maybe navigating a really difficult health period, but what comes out of it is an important relationship with a neighbor that you didn't ever realize was going to be an important person in your life, and it ends up being good for both people. That would never happen if you didn't allow space for the suffering and the needing of help and the connecting with others. But really, it's saying more that you need to acknowledge the suffering while also creating a space to be able to be appreciative of what you have, and try to hold the two things in balance at the same time. It takes an intentional effort to regularly orient yourself to the positive people and things in your life. And this is actually really difficult. We don't do it naturally. Evolutionarily, we've always come to look for the problems, look for the dangers, look for the mistakes. And we, as people, our brains naturally focus on the problems and mistakes because we try to avoid making them in the future. And if there's a giant hole and you fell into it, and it was at the bottom was a pit of elephants and cheetahs, and they were all going to trample you and eat you in the jungle, then you wanted to remember where the hole was. So focusing on where that was, and not the pleasurable clearing where you were nice and safe, was evolutionarily better. But we're still wired that way, to see the problems and the dangers. And this is actually saying, okay, I have to intentionally balance that by seeing the things that I'm grateful for and that I'm really appreciative of. And how you do that is very personal. It can be expressing it to yourself or expressing it to another person. Expressing it in a relationship is good, but doing it internally and just for yourself before you go to bed at night, as long as it's routine, is the important part. It's like that ritual of sharing around the Thanksgiving table where everybody goes around and says what they're grateful for, but it happens every day and not on Thanksgiving only. And you also have to, and it's probably more than one thing. You say your one favorite thing, and it's pretty easy to find that one grateful thing I'm grateful for. I'm grateful for my kids. I'm grateful for my family. I would pick that one every day if I really had to. But going for 3 pushes you to find some of those little things, the little moment where a colleague was kind, the little moment where you said something in the grocery store to somebody who really needed help, and you picked up something that they were going to lose their glove or something. Just those little moments. It gives you a chance to go back over those in the day, and it really changes the balance of how you reflect on your day when you remember those moments that might otherwise have been lost. Some people like to journal and they will write it down. There's challenges on the web. If you Google gratitude and practicing gratitude, it's very easy to find lots of different ways to guide this and just to begin to experiment for yourself. I was surprised at how powerful it is and what a difference it does make when I tried it, even though I still have to try to remember hard to do it every day. So any good talk should always wind up with Winnie the Pooh. Piglet noticed that even though he had a very small heart, it could hold a rather large amount of gratitude. And I feel like that's not a bad place to stop here. I hope that this has been helpful and it has not been a paradox. And I wanted to give you a couple of list of the resources that I mentioned. That's the CBC interview, the brain teasers, and the Stroop test, in case you missed the name and wanted to try that one out. So thanks very much, everybody. I guess question time, if there are any.
There are a couple of questions for you in the Q&A, and there's a comment in the chat that you might want to address.
See the comment in the chat. Thanks for that. Yeah, gratitude includes not only thankfulness, but also forgiveness. And I guess in that sort of, implies a gratitude for the, maybe the positive or the redeeming aspects in forgiveness. Yeah.
Melissa, in the Q&A, there's a question about Aricept, if you want to answer that first.
Okay, let me, okay, can the drug Aricept occasionally cause a person with Alzheimer's to suddenly do crazy things? I read a study that said this happens about 1 in 2,400 people. Suddenly through, well, I think this may be the kind of question that we probably both have opinions on, Chris. I mean, I guess any medication can do anything in a really rare occurrence to anybody. But I wouldn't say that it's common that the drug Aricept causes people to do really unusual things in and of itself. More common, the drug Aricept has a very subtle benefit, or maybe it seems almost to be doing nothing at all, and it's a bit more of a protective effect. And there are lots of reasons why a sudden change in an older person's behavior would be explained. Often some of those reasons are quite hidden. There might be it might be a subtle infection. It might be, some kind of pain that's underneath. So I think there might be a bunch of different reasons. I wouldn't want to ascribe it to the drug Aricept without looking broadly at all of the different physical reasons that could be there. That said, she's off the medication and it's not happened, which is good. I think it's just hard to know whether that was that or whether there might have been other things that were coincidentally happening at the time, because it's not a very common thing to happen. Chris, do you want to add anything to that?
No, I would agree. I think we all have our kind of things that we've experienced with any medication, and that wouldn't be one that I would include in a sort of spiel in advising for or against the cholinesterase inhibitor class of drugs. Great question. Definitely a possibility, but it would be probably less common than 1 in 2,000, which is,
Yeah, exactly. Extremely rare. And even the benefits that can be rare are probably a fair bit more common than that. And yeah, it's nice to see you again, Mrs. McMartin, or at least, see your typing. I remember you guys well. What do I mean by the 30-day gratitude challenge? It's a little bit like a 30-day yoga challenge, or all of the things that came out. If you Google it, the one I saw gave you a list of different things. It was different prompts to be grateful. It was really about a practice of a 30-day. So one day it was, being grateful for something in your work environment. One was your family. One was about something that was available in abundance. And there were just a list of things to sort of prompt you to think about different dimensions of gratitude and get started on thinking and trying to establish that new habit, as Chris said, of getting into the groove of it and making it a regular practice. It's pretty easy to Google and get some ideas.
Wonder, would it be okay if I just quickly showed this pre-questionnaire that I was alluding to for the Fountain of Health, Melissa?
Oh, sure. I was going to talk about the Fountain of Health and you beat me to it. So I'll stop sharing.
Okay, perfect. You start talking about Fountain of Health and I'll bring this up.
No, it's excellent. And it was it was an initiative that was originally led by a geriatric psychiatrist, although it ended up being a multidisciplinary collaboration. It's a really good Canadian example of positive work. Oh, we lost your volume, I think, Chris.
You're probably able to hear me, but I'm not sharing the screen anymore. Let me try that one more time.
Yeah, you can see that.
Okay. We'll send the link around, but I do suggest it's a really good way of looking at how you're approaching sort of any point in your life, because I think these are relevant, as I said, whether you're 25 versus 75. We'll send the link around for Fountain of Health, because I do really think it's an excellent way, and I use it clinically in very specific circumstances, but also kind of recommend it to people who are just asking about ways of helping to do as well as possible as they get older.
I use it as well. It's excellent. Nice, a good little browse on a rainy day.
Thank you both for that. The takeaway is that if we want to age gracefully, we are to remain physically active, have a good diet, make social connections, keep our brains working, and get some sleep. And then lastly, practice gratitude. My father lived into his 101st year, and I would say that very well describes exactly who he was. And the gratitude part, in spite of the fact that he was a prisoner of war for 2 years and was completely dispossessed by the communists in Hungary, continued to have a very positive attitude to his very last days, and was both cognitively and physically active. In fact, lived independently until he was just before his 100th birthday. So, and looked after my mother for that matter. So thank you very much. And as was mentioned at the beginning, these presentations were recorded, so they will be passed on. I think your mics are causing feedback. There we go. So these will be recorded, or have been recorded, and therefore will be posted to our website and our YouTube channel for you to enjoy later on. Thank you all for joining us. Thank you for your past support and your future support to healthcare in our region. If you're interested, the second annual Streamathon will be on November 18th on Move 98.3 with Reed and Ben. And that will be starting from 10 a.m. and go on until 2 p.m. The focus will be on our Honor Your Caregiver program and feature donors and the people that have been honored by them. And the musical guests will include Dean Brody, the Recklas, and Jade Eilson. We also started a new program of text to give. So if you're interested in making a donation right now, you can do so with your phone by texting I-CARE to 20222. So that's 20222 from your phone, and a $25 donation will automatically be added to your phone bill. There will be a survey sent around at the conclusion of this. Please take some time to complete it so that we can continue to improve on these virtual webinars. And again, thank you all for having participated, and thank you both for having presented today. Thanks.
Thanks very much.
Our pleasure. Take care, everybody. Nice to see you.